Have you ever had a client be incredibly impressed with the treatment that you have delivered because they've received an outstanding result? Okay, that's great, except that there's a problem in that. Well, the problem is not in the helping or in the outstanding transformative results that I am absolutely sure that you are getting, because with every solution, there is inherently a new problem. So the problem in this situation is us. Yes, it's us. And you know, if you have this problem, if your happy client returns to you in a week or a fortnight or a month and tells you what an amazing result that they have received from a different therapist, a different practitioner. It could be, oh my goodness, yeah, we had a good treatment, Christine, thanks for that. Oh, but I went to the physio after I saw you and they completely fixed me up. Or I went to the chiro after I saw you and they completely fixed me up. Oh, yeah. And you're thinking, hang on, what problem was it that you went to them for? And they say, oh, yeah, it was my back, same as what I came to you for. And you're thinking, and when I look at my notes here, I can see that the result that you got was an increase in range of motion. You could actually bend over and put on your shoes again. And there was zero pain felt post-treatment. And then when I followed you up 24 hours later, you were still happy. There was still no pain and you could still move pain-free. Yes, that's right. And then the next day I went to the chiropractor and they fixed me. Now that is a problem. Recently, I have been speaking with a lot of therapists and I have heard this story or an iteration of this story many times in the last wee while. And for some therapists, it is a total bugbear. They're like, this drives me crazy. What can I do about this, Christine? So let's just think, let's rewind. The client arrives to you. They've got trouble bending over. They've got trouble putting on their shoes. And then you bring them in. You do the best, most amazing massage. When you finish the massage, they can bend over and put on their shoes. And then the return visit, they're like, oh yeah, after I've seen that other therapist, I could put my shoes on again. It was amazing. This is very strange. I thought, what is happening here? So I took it upon myself to find out. So I found out two things. The first thing was that as massage therapists, we are not very good at benchmarking. We are not very good at taking a snapshot of what the client is like when they arrive and actually writing that down. We do that part, but we don't point it out to our client. We don't say to them, so when you're trying to put on your shirt, you can't actually put your arm through the sleeve. And they go, no, I can't. So you're having to put on your shirt this way. And they're like, yeah, that's how I put my shirt on. And you're having to adjust your behavior so that you don't hurt your shoulder. Yeah. And when you saw them hang their coat up on the hook on the wall of the treatment room, you saw them wince in pain. And did you point it out? Did you say, oh my goodness, that looks jolly sore. How's it feeling to you? Yeah. It's hard for me to do that, so I'll just do it with this arm. Yeah. Okay, righto. So we fail to point it out before and then again afterwards. And amazingly, physios and chiropractors are super skilled at this. This is their training. They are taught how to do range of motion, range of degrees, write down before and after, tell the person if that's within a normal range or an extended range or less than normal range, how many weeks that they should do their exercises for in order to see a difference to this range of motion. Now, what happens with those guys is they will do a treatment, they'll benchmark, they'll do a treatment, reassess, point it out to the client, and then the client goes away thinking, oh my goodness, I'm so glad I went there because they totally fixed me. So there's a lesson in that for us. What we need to do is point it out before and point it out afterwards. And there is ways that we can point out how much we have helped people in really elegant ways without ego. So you don't need to stress about, oh, I don't like to, big myself up and all of those things. So you don't need to worry about that. The way that I think about this is I am expanding my client's awareness. And I can do that by getting them to set exact specific treatment goals for the outcomes that they would like to happen, even if they think they're not realistic and that I shouldn't even dare to imagine this outcome because it's just a massage after all. So let's give you some examples. So people that come in for a scar treatment, sometimes I'll say to them, so in an ideal world, if you could have your goal, if you could have a wish come true physically, what would it be? And some people it's like, oh, I just want to run without pelvic floor pain. Other people, that might be somebody with a C-section or hysterectomy. Other people, it's like, oh, I just want to do those deadlifts without any back pain. And that could have been somebody who's had, an appendicitis removed or something like that that's affecting their core strength. It can also be, someone who's had a shoulder reconstruction. I just want to be able to get dressed automatically without wincing or making wardrobe decisions dictated by the avoidance of pain. So it can be things like that they're like, this just seems really unrealistic, Christine. Really, you're pushing me to say, in my wildest dreams, I'd like to get dressed without pain. Yeah, if that's your wildest dream, that is something I can help you with. So other things that I always do, especially with scar treatments, is I will take before and after photographs and video, and I'll do that of their movement. And if it's a shared client with another allied health practitioner, what I do is I will send the photos, videos to the client and the allied health practitioner so that they know, everybody knows what I'm doing. It also really, really, really points out before and then afterwards. You can say, oh my goodness, remember when you came in and you couldn't even sit comfortably during our consultation. And now look at you, you're relaxed, you're happy, you've not got pain. Gosh. Or you can say, remember when you came in, you were struggling to hang your jacket up on those hooks on the wall, and you opted to swap from the right hand to the left hand to do that because of the shoulder pain that you were experiencing. And they're like, yeah, okay, I want you to reach up and take your coat off of the hook with the affected arm. And sometimes you don't even need to tell them, they just reach up automatically and do it. But the trick is there, point it out. This is the gold. You're not tricking people, you're just pointing it out. Oh my goodness, look at you being able to get your jacket off of that hook. Remember when you came in, you actually swapped arms. Yeah. Or somebody can come in and instead of turning their head to look at you to have a conversation, they might turn their whole chair to have that conversation with you. So you can point these things out to people and say, oh my goodness, do you remember when you came in, you couldn't actually sit there comfortably and turn your head towards me. So by doing that, we are pointing it out to people and we are actually embracing our knowledge and stepping into our expertise in the treatment room.